Purpose of today's class, just to give you some information, things to do before you come in for surgery, around the house, some things to prepare yourself, what to expect the day of surgery and the days afterwards, and some things to think about discharge planning. There are some infection prevention steps that you should be taking before surgery. Then, day before surgery, you're going to get a phone call from the hospital. If surgery's on a Monday, you'll probably get that phone call Thursday or Friday. It's going to be, like I said, from the hospital. It's going to be somebody to tell you, first of all, where to be and when to be there for surgery. They're going to tell you when to stop eating and drinking the night before, and if there's any medications you should or should not take that morning of surgery. If you have a voicemail or answering machine, they will leave you a message, but they do like if you can call them back, just so they know that you've gotten the information, since it is important information. And then what to pack. You don't really have to pack much. You're only going to be with us a couple days after surgery. So, day of surgery, it's going to be a busy day. You're going to start out at the hospital a couple hours before surgery actually starts. This is not to make you more anxious or have you just sitting around waiting. There's a lot of things that have to occur before you go into surgery for your safety. So there are some risks that are associated with surgery, but you can rest assured we do multiple things to address them. You see activities in the middle there in the circle, because activity is very important in addressing all of these risks.
Pain control is big for both of us for nursing and therapy together. So we're going to make sure that you have your pain medicine. Basically, this is the goals that your doctor wants for you to have before you get out of the hospital. So you need to be able to get in and out of the bed by yourself, get to the bathroom, walk at least 100 feet, bathe and dress yourself with a little bit of help. The stairs are another big thing. And then there's exercise program, and then pain control. So as far as therapy and nursing, this is what we're looking for. We're looking that you can get up, you can move. We'll do the steps with you. And every day is pretty much the same thing. We're going to get you up, move, and exercise. And then nursing also will take over at the end of the day and get you up again in the evenings.
Green is good, so keep on going. That's a good day. Well, what about if you have some redness around the incision or some swelling? Is that normal or not? Well, if it's a little bit, it's okay, but it's definitely something that you should be looking at and watching. And then things, obviously red is stop. That's an emergency. Call 911 or go to the emergency room if you have shortness of breath, chest pain, or sharp pain and inability to bear weight on your surgical leg. So it's just a handy tool for you to put up to kind of know and judge where you're at. A lot of patients go home and they notice the swelling and a little bit of redness, and they get worried about it. Some of it's normal. Some of it, yes, you should be worried about if it's severe. So this kind of helps with that. So I want you